Hi, I'm Christina Bauch. I am a physical therapist here at Rebound Physical Therapy in Topeka, Kansas, and I specialize in treating pelvic floor disorders. So today what I wanted to do is talk to you a little bit about what to expect when you come for a physical therapy evaluation. So first of all, what we'll do is we'll go back to a private room and we're going to sit down and just talk about what kind of symptoms you're having. A lot of times people will have a long history of issues that have, happened, maybe surgeries or past traumas that have affected their pelvic function. So sometimes we kind of go way back to what history has been happening in your pelvis throughout your life. And then we're going to talk about also what currently is happening. So it may be just kind of a building of the same symptoms, or sometimes there's a change in symptoms. So we really want to sit down and talk about what is going on specifically with your symptoms. Maybe, are there certain triggers that are bringing on your symptoms? How's it affecting your life? So we kind of want to get a good understanding of what's going on and how's it really affecting you in your day-to-day functions. So the next thing that we'll do is we're going to do an evaluation. And so this involves looking and kind of screening for, is there anything going on even up in your spine, or is there issues going on in your hips or your legs that may be contributing to what's all going on in the pelvis? So we're going to look at all of that. And then if you're comfortable with it, part of what we may recommend is to do an internal pelvic floor exam. So what that means is it's kind of like a basic pelvic exam, but we are looking at what's going on with those muscles. So sometimes the muscles may be holding a lot of tension in them. Sometimes there may be trigger points or knots in those muscles. And so if that is something that's going on, that's going to be the best way to evaluate that is with that internal exam. But that doesn't mean that we necessarily have to do that. If you're not comfortable with that, that's definitely not something that we need to do, especially on that first visit. So we always go with what you're comfortable with, and we can kind of weed through and figure out what the next step is from there. After we collect all that information, kind of see what's going on, we're going to go through and some of this we'll also do before we do the assessment, but explain to you what the anatomy is of the pelvis, how things are supposed to work. So looking at all the muscles of the pelvic floor, what they're supposed to be doing at the appropriate times, and then we can connect it to what actually is happening with your body that's causing your symptoms. So we're going to look at all that, put it together, and hopefully explain what we need to do to get you better to resolve your symptoms. So the other thing that we'll do then is to talk about a plan. So we'll work with you to kind of figure out how many visits we expect it to take to help you with whatever issues you're dealing with. Sometimes that can vary a little bit as things go along. There's not really a cookie cutter approach, so it's really individualized to what's going on specifically with you. And sometimes some people progress faster, some people progress a little bit slower. So everybody's a little bit different, but we should have a pretty good estimate of what to expect. And then so that we'll talk about how frequently you need to come and approximately how long we expect it to take before either your symptoms are resolved, or at least until you are able to do it on your own with your home program. And then in that first visit, we also try to at least teach you one or two basic things that you can work on between then and then your next visit. So it may be teaching you an exercise. It may be just teaching you how to be more aware of your body throughout the day. So some practical things that you can do to hopefully improve your awareness of your body and start that process of resolving your symptoms. So I hope that this has helped. I hope it gives you a little bit better understanding of what to expect with your evaluation. Just remember that we're going to take things at your pace, and we're never going to force you into a situation that you're not comfortable with. But we want to try to help, and the more information that you can give us about what's going on will help us to get there. So if you are experiencing any symptoms in your pelvic area related to bowel or bladder or pain, that's definitely something that physical therapy could help with. So if you'd like to just chat with me about what's going on and figure out if it is something that sounds like it would be appropriate for physical therapy, you can definitely reach out to me and I'd be happy to chat with you. Thanks a lot.